Ebusama Joy, Memakwaba, Edoba Health and Coverage Mediso. Within the Richmond, offering me celebrity Nessa, Majoso. Health and Coverage Mediso, on a better Pomudi Hunsama, a hinter. A handy bisuya, Yapomudi Hunsem, or quite facilitating Yapo, Munan Fansons Bonnie, Embrain. Ebusa coming away. That's my back on tell me you got to Yapo in San Francisco, and Combra. Ebusama Kwaba be a Medoba Health and Covered Jumediso. Nia Oshei a cardio exercise. I hope say uteki part. I hope say we sunya de so every mo. I see a TV. Yaudani yaude biano. One me bedi impu na yahwe yapomudi ho sem ne aka nwumai mene opan kese bi na wo fi ha Mr. Alex Obi Kwan na mene na wo fi nwumai ba yitwin komo kakra afa drug abuse. I know say make drug abuse no wadwe akọ nubone so nko na wadwe akọ na mom be say hu say enye sanko na te sebe ni atwama hospital kra se kotokra no say wanye ni yi a wa abuse no ne santi ma menja bofo nkra to ne emre na emesuande enkomra.
Introducing Idas Shipping Services Limited, your premium partner in shipping solutions. Come to us for your excellent door-to-door air freight or sea freight to Ghana, Nigeria, Uganda, the Caribbean, and the rest of the world at affordable rates. Our streamlined processes ensures that your cargo arrives safely and on time every time. At Idas, we ship personal and commercial items, containers, cars, and parcels at affordable prices. We are also into airline ticketing and money transfers. We are located at 65 Upton Lane, Forest Gate, London, E79PB.
You can also call us on 0203 9760 697 or 079 4736 1067. Email us at idas.shipping@yahoo.com.
Idas, the best in town.
Ebusia I Health and Covered Jumediso. Memakwaba biom. And you me Mr. Alex Obi Kwan na wo fia a yabetwim komo afa drug abuse ho e ma we say Idas Shipping Services na yawde bia almost yasen ama mede dwumadi ebrew Idas Shipping Services omuna mes no 02039760671 02039760697 e ma we say Dr. Gamo Temple of Justice. Also, we can say for how nyina for our spiritual problems na fa brand ho Temple of Justice. So what you know Temple of Justice. Sabi ho onko any ape. For how ko na onso asin na bibia anya fine. Dr. Gamo ewo 0246 623115 02037974455 Temple of Justice. For our spiritual problems any hypertension, stroke, gonorrhea, waist pain, blood pressure, typhoid fever, baby all do wa obetenete ediamount. Ebusia emri ni ho emanipa. Mame nua kwaba na yenhye yen komo twetwe na se menua mo akwaba I hope say bia boko nyame adom era se bibia aye fine enwume yen komo a evidence say adeso ebesua no ne ti no e drug abuse make drug abuse meaning say amanfo adwuna kwa chi obi adwuna contampe so obi adwuna ko ne kan ho so but me say onfa yen bra fie wakwa pharmacist me say onfa yen bra fie yen dada sesena mu ene yen ayaresemu no yaka drug abuse a menchechemu akra efie kwan so ana say apomuden kwan so ene numone sem kwan so no menchechemu akra na hwe drug abuse as kire
many drug abuse mainly defined in two ways.
Okay.
The kind of drugs.
Okay.
The second one is the abuse.
Abuse. Okay.
The kind of drug being legal or illegal. So because it's legal, actually say it be a prescription from either the hospital or a health center.
Okay.
And then being OTC medicines. Say it be a wako drugstore and a pharmacy shop wako top. And then the abuse is when you overuse the medicine. For example, say a dress no 2 anopa, 2 awia, 2 enyume. Now it's an say a don't yet ketua, and now say a don't kesian. Oh no ma broso.
Okay. Nti wo ye fa no 2 anopa, awia no enyume no fa no 4. Wow.
Say one who say a don't yet ketua nintino, or fa 4. Perception is say me ampa make a city say me na me no medru baako na mienu na bia all kofa abroso
okay kabo na want on intem
abuse.
Wow na mesreo adenti na nipa bi enfama adwen koso ana wo nsusu na nwe ho say ndo eton drugstore eton pharmacy ana ndo ya prescribe say koto no e ka drug abuse e ka ho adenti nipa bi enfama adwen emmu
one say community and say environment I want say o can be say drug abuse na e madwen ye sebe in tampi bi and say be ndo boni bi na I madwen ko say o call drugstore and o call hospital near kire say no medro no e bia ba kwa no pa ba kwa nwumre na o call no
overdose. Wow na insuranso bi eni ho insuranso boni bi eni ho
insuranso boni bebre was many nedi kind no edu bi ayerema was hospital and ayerema was drugstore sebe amanfo shada tenase akomudin nyansafo tenase and omo ye the composition omo kawebo omo say the right one aye kaboma ebeboa wo ebi anopa the right one kaboma ewia the right one kaboma enwumre affect liver and affect kidney say bia onum tu a ebeje edu bi wo kra ye num de bia ba akon
yeah
ebi so wo ha ye num na enwumre pe
yeah one at night sure
but sabi say ye num adua mbaso na sabi ye num broso a menia there are a lot of effects also because sabi edu na kasa ne chemicals
sure
and chemicals so ebe ma side effects
sure
so mostly no ebi mo am ko hospital a no mo ko pay dro bia ye catch you say didie ebi bi wo ha udidi ansa na wano ebi wo ha no ansa na wadidi because of the reactions I draw no work with the system to ye chiro but sabi ye nuanu bi wo am fa way into consideration now so the mind okay
what's my come am make military bi wo UDS Prof Nafiu Nyamisha Prof Nafiu Nyamisha biom make I say you student bi wo school na biochemistry one of the chemistry courses and we learned that the body the human system no is made up of chemicals senia a Christ of Ujidi say yango na bo nipa na ebisu say nananom na e boss ro bo asase no book no say nipa na form of chemicals ni say ba say uti paiwa meaning say o para na wo system no mu no atochima nti no for para kakra e support no so nya kan am no adwe na yenko outside the clinical settings kakra alcohol a drug tobacco a drug but illegal how effective is it how does it destroy the system like how do people abuse these two drugs
okay in this medicine sector some of the hematinics maybe contain ethanol but it has the right percentage of ethanol and then the right volume.
Sure.
They come this hematinics are a body. Tobacco, for example, tobacco more or less has more side effects as compared to even alcohol. Because sometimes even the body needs alcohol. But the body needing the alcohol sometimes from foods, not from chemically made.
Sometimes the body needs alcohol. Okay. That's what you said.
Yes.
I know so. Mr. Bisao, sometimes body needs to smoke a crana.
Not really. That's why.
No, maybe say yes specific.
Not really.
Maybe say answer yes.
No.
Say yes and no. So how did you hear me shout? What's the question? No, yes and no. So the body need hear coke sometimes, no. Body need hear smoke sometimes, Anna.
No.
The answer is no.
Yes.
Thank you. But
the reason why the body needs alcohol, they say, you see, the alcohol content, it's needed by the blood for good circulation.
Sure.
But the smoke, the body knew here, until I told the people who said, yeah, my mom more mukasino. Sabe, say, we see no coin in poor. It can even develop into this asthma, this lungs, a whole lot of issues in the body.
Wow.
So the smoke is not needed within the body to do anything.
So the smoke is not needed in the system at all.
Sure.
Ebusama mjina wesu lamifa enkrake se ema Kola Money Enterprise awo Taifa Junction nyamisha na otum kwandem. Miami designer Oti Erickson nyamisha abri nyina no o try so o me ho efe on set nyamisha. The body doesn't need smoke in any way.
Yes.
This is what our pharmacist is saying. And not that he is saying, I'm emphasizing, I'm telling you, say, smoke is not needed in the system. Whatever thing that you are smoking is not needed in the system for any good purposes. It's not needed. It's even too intimate. Now, Sani Mami, you know, a long-term effect be.
Yes. Especially smoke need a whole lot of issues. For example, if we inhaling air, it goes to the lungs. And then the lungs is able to
any ahrawano sharp.
It's able to differentiate the composition of the air. Now it means and the air filter air and then air no.
Maybe so on catchy. Na air filter air na near there way.
And the sunny from
Ofikwa. And how you do ah. Ofikwa price and mama too chini ye.
And sunny air no so. Now a bad part of the air and inside. And mostly they say if you inhale this air, right, it passes through the lungs.
Yeah.
Right. And then if it being smoke, it leads to this lung cancer whole issue. That's why mostly some of us say the cigarette box smoking is harmful to your life. In Tubasha, if you are normal the lungs and our friends say
ahrawano
atom. Now how much they say the effect of smoking will cause this to the system. Air lungs Secondly, I say I told you na sabe onasi atata. Mostly one smoking. One says sabe no man nasi atata. Why? Because sometimes one it leads to this liver. Now this liver can't purify this smoke. Right? Until ever come back to the kidney to expel the smoke out. Suppose after that's a kidney no intimate filter, intimate sonny from my so I'm an amber in the form of urine.
There's a problem. A problem. I feel want to go private on sweaty. Now feel that should be so be na boni dua. We ti obi aduro so. In some hunu bebre. Menua me say try home bra. Now before then no my miss our same way. In do I prescribe your hospital. What prescribe my what trauma and say boy home buying na enya pomodin ebi enum traso sɛ ne yedi kan kan fitiase no ebi num ma ne boro so e wo so asobɔne e ma nipadua no eche enche ebi di che ana ebi di nche be se ntwa ye homra na me nya bafo nkrato ebusua sima ntwa homra yesi atewo.
Introducing Idas Shipping Services Limited, your premium partner in shipping solutions. Come to us for your excellent door-to-door air freight or sea freight to Ghana, Nigeria, Uganda, the Caribbean, and the rest of the world at affordable rates. Our streamlined processes ensures that your cargo arrives safely and on time every time. At Idas, we ship personal and commercial items, containers, cars, and parcels at affordable prices. We are also into airline ticketing and money transfers. We are located at 65 Upton Lane, Forest Gate, London, E7 9PB.
You can also call us on 0203 9760 or 079 47361067. Email us at idas.shipping@yahoo.com.
Idas, the best in town.
Ebusama akwa bi o Medoba Health and Cabed Jumede so mene e kan say Mr. Alex Obi crying na ofi atwen komo afa drug abuse ho before you call break no na me bisa no say you can prescribed medications are eno de wo he ebi susu say what some fan anopa ba ko ewia ba ko nyume ba ko no kwan mienu miensa se na bia no beto ntem so e won so anso bone nso na beche anenche obi di beche ana obi di nche ni na epe ana ni enyepe menua manchechim kakra
menua so we call hospital said or the yarena or the echo
yo
and you know the doctors na said the prescribers are more hospital edi kan no obeka o yare a kire o said ni eyo say uti na eyo ya say awo na ede o say o BP wosoro say o sugar na wosoro na the doctor na share the right medicine on the better. Now the doctor bia or duration or mere or the bema one no a drone. No, what time of actually say be anopa ewia enwumre. Ni nyina no doctor na bechiro. I said doctor na chiro niama we. Na se sebe. Isan say ohun say eye ba ku de bia no eno na mwa. Na se be wa wo beye say wo na wo benom no say ba kwa no pa ba kwa nwumi na di kan no wo fa adura adura no koto your stomach ni na enzymes na hydrochloric acid aye juma wo so if you are then a move it to the liver na liver no ahwe ne eye wom ne ne enye wom na afi akọ back to the bloodstream ohono na ebe pusi mo ebe fa mojanim pusi akọ be bi a say adura ne ko from there, no, now we move it to the kidney to filter and push the water out. Then the residue will go to the rectum to store as feces. Medical, one will say the right amount of chemicals, and a doctor natural amount. Say konakoto.
Yeah.
Na nom no mere say any say. So one nom me bro so a sabe medical no ebe koto oyefunu. Ohona say oyefunu eje so aduma na sebe edoni bika because of your bad intake it may lead to ulcer.
Okay,
that's number one.
Okay,
so eco liver name na sebe liver no enya the right one and enya excess it leads to another liver problems.
Wow.
Liver name.
Wow.
Sometimes say the right amount anko ecotomogenim na still excess ni bika and so it give you this blood cancer.
Wow. Wow.
From there, it moves to the kidney. Say the ABI say expel some of the medicine out, and that's some of the chemicals out. Now still like SS woman, it leads to diseases or sicknesses like this kidney stones.
Now say we so I say who abuse hospital no na.
What you're going to get.
Now then na nipa bi adwen say safe to use those drugs all the time.
Me one say medical no say obi call pharmacy na call hospital na okohu aduro ha onim say because of say Alpha Food and Drugs Board are approving that the medicine is too safe and as said one say doctor na share no it makes the medicine safe for him to take but bear in mind the patients or the client or condom no abuse here then na say I in excess.
Okay.
Me opportunity make an what
Mati pa
because SSR say I say o sa ho yare mum no sa ma
Osa luska akoto yare ama ho. Me nua ma me twa no ha. Painkillers. Any cough syrups. Aye nru mienu bi a emrante na abizu ni pa. Emrante na mabawa no. Omo abizu no papa pain me bodu bi din but painkillers and a cough syrups. Omo abizu ni pa. Esun so yeden.
When you are painkillers, no. Medical, no. Your this types of painkillers, right? But for now, no. Main breaking it down, for example, what we say painkillers need to contain caffeine, and over abusing of caffeine leads to this ulcer, right? And then this cough syrups maybe containing this addiction type of chemicals. Yeah, say one of the right way. Now for abusing her, it leads you to depend on that cough syrup. Some cough syrups no, on normal better because mostly no, our coughs only comes at night. Some they are there, you know, and as some of us no, and as some of the patients number one. So it contains this chemicals. I don't know my order, but because of that, you know, until the end, says that type of cough syrups are normal better. So more than no sabe. Benum cry no ma abusing no. So original sabe. I say about TV so radio so say e no ma so okoda no original.
No original or no that. Standing sleeping. Odomoshi no. Asembe nkra ni.
I don't know. Some of even the clients, you know, depends on this cough syrups to sleep. Say last time I know cough syrup we na me no ma me die. Until na fe abeno.
O presedu no.
The bia no be no more better.
Now your warning signs be say obi abuse over the counter drugs are yehu.
Sure, media. Baby wo.
My back me bi nhwade.
Medical no edu wa o nom na who abuse na. Ebe ma ye drowsy kakra.
My drowsy no fa go trigger some.
I say when you so blue kakra.
As we ujina want me jina here.
I say when you so blue kakra.
Wow.
And they do wa o nom painkillers no overdose it leads to another headache. Some of the painkillers who are abusing are also feel you are getting these sharp cuts. Because of this over or abusing of this this painkillers, this cough syrup leads to swelling of the feet.
Wow.
Of the palm.
Swelling of the feet. I say ni kidney ho ya kan no.
Sir. Ebia na over abusing of this painkillers na ma unya this kidney stone.
Wow.
So say the kidney not me the right procedure yin so the feet system nim no. Enya kwan. Na fe say so no kotata wona ase. Say be bukwa wana na ye fon do a. Ona ye say obi a no obi ato aduro.
Ebusan ma me hu comment comment section ho. Ma me hu comment ase ho. Senior doctor and as a pharmacist o kanu. O abuse painkillers no. O fandu no ma ne bro so a. Ona setimi tai. Wafu etimi hye. Onsa etimi honhunu ne ade. Na ne onim no se weti obi aduro so. Obi abodua, obi ato aduro. Yeji bibia di. Ni obo so basase yeji ne di, yeji nua di, yedi tumi bia o wiase bia na yeji di say wo ho. Obi a woni role play. When you talk about health, good health no, and you physically fit spiritually, financially bibia ka ho. But physically no, you apomudi ho adwuma. Medically no, make sure so we are fit. And sana we da kwhye the other side. Yama painkiller fa ba kwa no pa ba ko nyume ba ko nyume wo se there bi me fa no mienu mensa no bi apai sachet ni na na wafa yesre emwa yesre papa so na pharmacist ne ka no your kidneys will be affected and if you don't take care all the best will be meanwhile you caused your own problems minua my point ba ko mienu bi ka ho
meaning almost say the reason why people abuse drugs also be wa na sabe ni mood you are not sad mood and I feel once or by abuse this medicine. For example, let's take alcohol for example. Obi wa or bad mood one, then that person tends to take alcohol. That's a compare baby. Oh, but I'm condom kakra na sabe any jemra. Obi so wa tell my young palani e kan say me say ya budidi.
Oh, that's all. Yeah, that's all.
Oba no bibi kakra na say na wadidi. Oh, I had a friend abuse no. After say when ya bibi anu ma.
Ontimi nidi.
Na sabe onu kra ko no mawie no kra na ka sabe e bia wa no bibi to say bia 5 cedis na say ko di 10 cedis no. After bonus after ni matim.
Na ontimi nidi.
Yo.
Na say after wasana sem kra.
Oh now it will lead to the ulcer because sabe na fe insan kwa and insan and I say alcohol na say spirit. So spirit once no and it me too cruel yeah.
Spirit and I say spirit.
We say be wa on can bitters be say that she bitters be. No say I don't know the spirit form. We say afi it too cruel yeah. That also mean no be wa na up confidence. Nti ma we dey make father na chi na make up bibi na me ntwe na me imagine for confidence sake.
Oh.
Say be school mu e bia e wa adwuma mu. And obi so wa or person or stay awake. For example, tell me you go school. Now maybe I go to exam, sir. Then we abuse coffee. With the notion say you abuse coffee now. Yenda. There was one of coffee no
you're mining. Oh mining then.
Now also no
Oh, that's some more.
I'm under. So basically sometimes because of obi mood, obi wa confidence, obi wa because of the sad motion be a woni mu. And then Emma ko abuse some of the medicine because who say menum we am okay.
Now at the point say when ya no mo so e.
That's when it becomes the problem no.
Ebusun high health and covered Jumedi so. Emma we fi say idas shipping services and abi na almost so yasin. Emma dey health and covered Jumedi ebro. Temple of Justice, Dr. Agamo, as a country was if how you na fabra na so ye say pressure, say kidney, say one. So we have to withdraw, so we know tremendous was as say court in same Temple of Justice. Temple of Justice. Abibian Ghana for ye be peace, by empe justice. Ghana for ye be peace, papa, they be preach peace, by empe justice. Dr. Agamo say for us na bra, Temple of Justice. No di wasem, and for more. Minya say yes over the counter. In no, send a for abusing na doctors, pharmacists, over the counter practitioners. Omo kwen bi omo faso, and I say kwen bi wo ho betimi afaso aboa ama ya reduce drug abuse.
I mean I'm quite back on me bi wo.
Mayenti o.
The kind if the practitioner being the over the counter or the pharmacist or the doctor. The pharmacist or the doctor is able to counsel the client well. For example, eja uko fie die every way no udidi wia no ano bakwa nwumre and now say we no die mra wo didi no na wo no some of the diabetes medicine you take whilst you are eating.
Wow.
And some of the medicine ubenom for example unom this antacid and no ubenom asana what
did you?
If we are able to counsel our clients very well with a little bit of education, I think say enobebwa.
Mami fa comment back home ni bi na yento aso. Producer Fatu so mami na menkane yento aso. Mr. Martin Counselor J, thank you for your expert advice. Thank you, Daddy, too, for joining this and every Thursday. Of course, you have been with us from the very beginning that we started the show. And Tinia can say that Nyamisha, Papa Sabi Nano, Okayahu. Boss, good work done. Keep it up. My greetings goes to you all. All right, we take it and then we also thank you for joining our live section. And then we hope to see you every Thursday on our show. Thank you very much for joining. Thank you very much for joining. Comment na yen to aso. Minya sana maybe sano counseling. Se nipa no kwagine do pharmacy or hospital a ye kire no senior obefa no sometimes obi watch the do kwana doctor to me say sanfa bra na me nkyere o senior obefa no obi beje or pharmacy obeji sa advice no obe call doctor hobium asa ko advice yet obe abuse no ehun be hia say in the hospital settings no you be pay days bi na ya counseling just to let people know how drug abuse no affect the system no because me practice and as me hear service or St. Joseph's na your days are your education and your counseling emma diabetes for your days are your teachings emma hypertension for and your days are emma mental health for ebe tire you media wodi because sabe obi what mental health and na you say abodan for one common edi but mental health you can mental health that ko me be aba show you so you can mental health sometimes akola ojunso kra mental health challenge you on inform ojunso me say me junso akọ ss omo munim no munim me ss na me junso mental health challenge ehun be hia say you be pay days bi na ya counseling on how to take medications how important I say obehwe o prescription no say na e che no be fa na pepe ehun be hia sa
ehun be hia pa
man jem gakra
I'm ready kind no one say ye mama mu ana no ye papa no ana ye colleagues no say be omo call hospital da say because of say hospital be a one and then the population around the hospital no some of the dispensers no and some of the doctors no and some of the prescribers no you are nyamre because of the queue at hospital no. But it will be very very good say we can invite them. Maybe 2 weeks biano. You can come because if you are no repref. Some of our mothers no sabe. It's an feeling some name, you must them to do okra the normal ref. It will be very good senka. We invite them and still educate them on how to take the medicine. Meaning only say indoni ndobi wo ha enhia.
Manje chemo.
Indoni ndobi wo ha enhia. For example, yeah, because body and a problem and to the no will have because of the chemical composition it do why in share it do how bet man no eno who did we are as na one way we na make what man
sure
if you kura o ha enwura o ba beda and na wono this our benders on the benders on if you kura o ha you take it during time for you to go and sleep.
Sure.
All of this will be educated by the health people, to our mothers, to our brothers, to our sisters, to our fathers. So I know Senka, this hospital, Emma Kwaima Sabe, this suggestions out the buyer, at least Kabebwa, say be at this mental, you educate our brothers, our sisters, our fathers. We will educate you on this diabetic patients, this hypertension patients. This this 8 grand. Sometimes with this small council, you know, a boa. Because sometimes you see the society, social stigma won't kakra. But this counseling baso, no mean education kakra.
Kabe boy nyina. Minu amami bisa emra kwan so no. Your regulations be a ehwe yandru sem so. How it's being dispensed at hospital settings and as a pharmacist. Your regulations, your maybe how.
That's why sometimes you need a pharmacist. Recently they introduced this MCAs, this 6 months course.
Yeah.
I feel Ebuama, Yemianumwa, Sabe. I'm listening to a boa pharmacist. So they are supposed to educate the patient, say. With how effective the medicine is, this our Food and Drugs Board, this our standard board. They also see to it say chemical compositions of the medicine are in the right British pharmacopoeia way.
Now what you dey?
What
you sure?
Because before said they will approve a diclo 50 milligram. It means the medicine contains diclo 50 milligram.
You share addiction, any health impact. Addiction. So we are taught baby muna on jai. You share any so. but me say misa question be oko in Krasia ye onko form di ndru egu box mu ebi di ku bag mu e di ko chin e we fiefie mu o refio se ma ba o no buza bro be pie no aka ne hawo na wa mesi ama no no akola be pie o sa akola no wa shift nra no o ma mix ama no. Is it accepted in our system?
No, it's not acceptable in our system.
It's not acceptable.
Some Crawford knows pharmacy council south so more, there will be a problem. So this for the drugs board for so more, there will be a problem. Meaning,
Mamma Joano say pharmacy council is so more or awesome. I hold me to because even only license to operate.
Sure.
But sir, I got to know of pharmacy. I don't quite know. Into food and drug board so anymore. I don't know. Like how far with it? I don't know. And what I'm saying.
For one more, I didn't do question. I will fear. Say yes, so more. They ask them, say, you decide on say, "I'm going to do." Your toma
also awesome
because
okay.
Because to a broker or wholesale or company, you have to provide a certified license.
Okay.
Either from the Food and Drugs Board, either from the Pharmacy Council.
Okay.
And Sana.
The reason I'm asking, you know, me share clients be or community be. Now, me when say I'm addressing, and I'm take us no, my ba, see, na abro be there anymore. No can house in the year, ni from memory and yade. And as my panic kind say, on top red and yellow, tetracycline. Now on top trisilicates. Now on baby. Tetracycline no capsules no on bie mfangu tricycline nim no shake no na pa wi anwume. And I laughed. I was like, what kind of concoction is this? Me pray for the anymore. Ma me na ayade no ma wa so ma yellow she say I change yellow section leader. How safe is it? How bad is it? Is that drug abuse? Is it like drug abuse? How do you talk about that?
You see, before I said they will put any chemical in this capsules form. You see, it has to go to the body, right? Then it passes this first effect. The reason being is, what we said before, I said you take any medicine to the system. The moment the medicine enters the system, right, there is this hydrochloric acid. Your acid be away more and no dense in car battery.
Okay.
And on that acid will come down onto the chemicals or onto the medicine. And then because of that capsules, it breaks down. And so the chemicals is able to go through the bloodstream. And to say, a basa na say or two and good trinsilicates anymore. Personally, I say, only I can hear a whole lot of concussion or how do you know. For example, this trinsilicates mostly you can know as a didi. Trinsilicates mostly you know as a didi.
Yankopon hu yemobo.
You didi we are saying unknown capsules no.
Yankopon hu yemobo.
So I don't know whoever.
Nyame ke enya story na me ma wo. I saw it with my eyes. Me hui. Me tese wori kan ho asem. Me pie na me hui say mama na mix e do no truly a wo shake no benom.
I mean, I'm with your background. You need to educate the grandmother.
Oh, in fact, I told her.
Then say, Papa, na you class doctor now.
Oh, a champion area ho. Oh, a champion oba hope we say doctor about around. Oba shy arifu ina na wako.
I mean, then truly, I do it's really very bad. You see, the basa na say onya side effect na fe wa ba hospital na oba mad doctors name prescribers no a whole lot of problems.
Yankopon kan yo nyina ho. Ebusia mamisima na mja ba fon kato. Enzamrazia.
Introducing Idas Shipping Services Limited, your premium partner in shipping solutions. Come to us for your excellent door-to-door air freight or sea freight to Ghana, Nigeria, Uganda, the Caribbean, and the rest of the world at affordable rates. Our streamlined processes ensures that your cargo arrives safely and on time every time. At Idas, we ship personal and commercial items, containers, cars, and parcels at affordable prices. We are also into airline ticketing and money transfers. We are located at 65 Upton Lane, Forest Gate, London, E79PB.
You can also call us on 0203 9760697 or 079 47361067. Email us at idas.shipping@yahoo.com.
Idas, the best in town.
Ebusa me wakwa babium Adoba Health Uncovered Jumede so. Ene yen komo aye twetwen drug abuse. Say me kan no, e ka drug abuse a emfa wani enkoto cocaine ene ni aka so. Ni ya trauma hospital kra se koto kra no. Utimi abuse no e ma onya so so bone a emwa wapomoden. E ma remfi say Idas Shipping Services na eso masema mede dwumadi ebrel Temple of Justice and so ya saying emma mede dwumadi ebrel. Recent clothing and emma me nice scrubber eshemi emma remfi say me aminua Mr. Alice Obi crying and I will fear and na yen bre no eyaso me pese on kire ade kakra fa kwan edu mi misa wase misa me pese on kire ade kakra be sima enum bi kire ade kakra yen hwe addiction and health implications e obi wo ho a na ganye ne pese oba abuse edu no onya accident yamano tomorrow capsules 50 milligram fanana pa baako enwumere baako ideally can you say 10 to 12 hours intervals and I say be 8 hours intervals offer baako no 8 hours in so ye pains no kobo no ebro no to wasan for baako in 5 hours later eye and enye and 170 saying manjechemu alcohol tobacco over the counter medications painkillers cough syrups yede penum ye no mane bro so esusu so it is saying sima enum pe manjechemu akra na tu yanfo
my tackle questions that will be said. In the kind here, obi will have no accident, and I say, oh, that person is in pain, right? Maybe kind of so go hospital, then you describe what sickness now, the doctor, and that's the physician assistant, every mouth painkiller, right? In the form of say, every mouth pains now, but in most cases, no. What you describe to the PE or the doctor is the same medicine or them. So sometimes, so for hospital, that's when describing the pains and that's the problem to the doctor very well. So the amount days say review. And in most cases, say amount days say review. Now she say do now no it be 3 days, 4 days, one so still any good biana. You can go back to the hospital and tell the doctor, say, doctor, I do have the man for 5 days, but 3 days and still have pain now. It's either say the doctor no, either say obesity painkiller and I always say a drone amount. And now say more fano, we are no, but okay. And then I say fan 2 and up 2 and that is if the doctor says so. And when you per se over I did doctor Nakasacha say, okay, Minia, so what she say, I do have the mouth for 5 days now. If you are 3rd day, you still are any signs and symptoms, they are say in the form of a good living. And instead of somebody back one up, this is when the doctor says so. You see, with this OTC, as in the over the counter medicine and as a pharmacy. If you move to any pharmacy to buy a medicine and you're not able to describe your sickness to the pharmacist or the OTC, for example, let's use cough for example. You see, with coughs, now we have types of cough. One, we have the dry cough and we have the productive cough. We refer to wet cough. So we call drugstore and alcohol pharmacy. Now, one church say, "Oh, doctor, ebia me bowa, ebia one me bono." Mama kakra fi achireba. So when you describing the word, that's a okoma or something for dry cough. You see, but no drone for 5 7 days, you are not seeing any improvement. Right? And it's a one church and the practitioner and I said the dispenser now or want to mean wow. Because the wrong medicine will be given to you.
Sure.
And then it's up to you being the client and now you be the patient to explain to the practitioner. Yanko addiction is one mostly no. The reason why people tend to be addicted to some medicine is every clinic or every hospital or every pharmacy or every drugstore they give you a duration. Your mouth mere album metro. Nya catch us so no wie na se nwan to wa na sambra near show. So oko hospital the hypertension or the diabetes patient the amount on 1 month it do a amount on 7 days it do a amount on 2 months. So o share na one improvement bia na after 1 month and after 2 months no bra na say yes some amount and na say your amount no double of the dosage. All depends on the prescriber. That the line where this prescriber never try say no back on you may now say nastila improvement then no pa me no one say you no be or call hospital no a drum the man no e bia je no nti ohun say ni so what the same problem no say the command
of listen no
and the same thing about but bear in mind say there was this underlying symptoms be in the man.
The black group is from black group.
Thank you. And the ABA one no bono, ABA na a dry in a man and no me and no boy. Thank you. You know, sometimes it's good say you go to the hospital, complain the signs and symptoms of your sickness to the doctor. Mostly you say you go drugstore cry or say, me malaria group. And you say, oh, you're very good about medicine. When we say, oh, now then you. Ebia na uti ebia na awone do ebia na se na ye na ono a de ne pe beto adru wo sa fe do no okonom wo still engine. For example, there is this sickness be a friend of typhoid. Typhoid and malaria has very similar symptoms.
Okay.
And this say one typhoid test and one malaria test. One say typhoid no wenya and malaria no wenya. Oba no malaria do for some time. Malaria do for some time. And to know for some time, sir, I won't say still you're not getting any effect from the medicine. The won't say so no. In the 3 days malaria treatment, no, over the first was still and coy. I just have to repeat it. Won't say still na yare no was still on the side near you. And the message was says I'm hospital and I'm drugstore and I'm pharmacy shopper. You should complain your sickness to the practitioner and to the prescriber or no one can say infinite who say, oh, 3 days ni I way back, I own way. Now for the right medicine on the bema. Meaning I am called addiction. So there is this medicine you find cetirizine. Cetirizine no is for allergies.
Okay.
The allergies are to say be a when you're cold, it be a 1% being when you're cold. It be a to my young pala, no say number ben with one down no. And now berry and ben one way.
Yeah.
The most often you have to go who are wooty.
And allergies no.
And allergies.
Yeah.
They do all say your mouth cetirizine self no. So it's not say I want this induce sleep to say oh no man now that. But it will cure your allergies for you. And to say if you become addicted to because if you are on to men dance and now no more over that. Have you thought of say a dear na a other effects say a dear and then done pet but a cosa for a diana and yes I are now. For the cough syrups, some cough syrups no no more over that. Into the young young man in young man young man no muntimen that
and no
but only be someone say me more na me go no mind
na so at the point unum na one dance way.
That is when I over.
Na say area addiction ni mo
addiction that say say obi wa say mama compare 2 cities bi na me no na me if am bedidi I better me be now no 2 cities bi
na no 10
cities.
Wow.
If you become addicted to sawe now it becomes part and parcel of you. But these are chemicals that will get impacts with the system being negative or positive. The positive way in says these chemicals will heal you. What if say on yare now? Then it means that you're going to get this negative effect on you. How? 1, through the blood, through the kidney, through the lungs. Minia, assemble could be a man fun to do concerning the woman said not almost smoking on. Who said obi smoking beer ends up getting this different color with the teeth.
Sure.
We no obi wa smoky about say for 7 the secret no.
I tuntum.
You're going to get gum these cavities. Sabi your shop and nipa bebree ba. I said who to no for no. Sabi that's why I addicted to it no. Na ontie. No ontie. The last time you be go hospital, obu to no for ontie. Because of the smoking into the sin na sakala. That the doctor name man this paste so uncle use. What you saw side effects.
M1 was why
effects bano onhu hwe. That way the doctor say na menia na in the ajo kuta kasha.
I don't talk kasha because M1 no president you know it is so
that was ajo kuta kasha.
Menia mama da wase e na obra nyama enyume in fact my mouse ma back on small credit also me 30 seconds but fachi a wadofo ene ahwefo a omunya abre e de hwe wanyume yi.
Okay, then the guy no make your workers on Malex Farmers.
Oh.
Na Masenchia confirm with boys.
On
the 4th of October, almost all my program we will confirm wood.
Oh, okay.
The message say Armenian, you're very nice program. Make your madofo almost home and beyond.
Wow.
Yes.
Wow. Sani a membra kan no ochia na dofo ai wo su hum na fe incha kese enkoma confirm hood on the 4th of October Mr. Oliver Oklumante also oye party in the hood happy corner pub Tijanshin wa on the 4th of October MC besi memeda right yeah besi memeda on the 4th of October no mark your calendar no so na insha Tijanshin happy corner ebusu ana breba makwan na the health and coverage medino esi emare fi say idas shipping services na eboa ma ede jumadi ebrel Dr. Gamo Temple of Justice was for spiritual problems in fabra na onhwe enfama ebusa medin the Richmond we shall from celebrating us na akra me ho a why not mama obi eda hya ho mamija wa ha na da se ne ya woda no so pepepepe yebre na yensen hya biom medin nyame jawo